Welcome to Health Reform and Criminal Justice, Advancing New Opportunities, and thank you for taking part of this important conversation. And to those participating on the webcast, welcome to you as well. My name is Elizabeth Schneider. Liz Schneider. I have the opportunity to serve as Cochs Board Chair. 3.5 years ago, we gathered in this very room to discuss a concept called connectivity. The idea that healthcare provided in jails should be connected to healthcare provided in the community, and that by making that connection, we could improve public health and public safety. That concept is now becoming a reality. Due in part to opportunities created through Medicare expansion under the Affordable Care Act, jurisdictions have begun to explore different paths to connectivity. Some are working closely with community providers. Some are enrolling eligible inmates in Medicaid prior to release, and some are adopting new health information technologies to bridge health and public safety. There is no one right way of doing this. It depends on the jurisdiction, its circumstances, and its need. At the same time, policymakers are recognizing the critical roles that jails play in healthcare safety net, serving high-risk, high-cost population, a role that, under healthcare reform, takes on new significance. They are seeing that in order to bend the cost curve, the healthcare needs of the jail involved must be addressed, and jails must be partners with community providers in creating a continuum of care. We are pleased to be convening this meeting with Health Affairs. In March, Health Affairs, working with Cochs, published its first ever cluster of articles on health and healthcare for the jail involved, with special attention to implications of Medicare expansion. To me, this is yet another indication of how far we've come in the past 3.5 years. At past meetings, we have discussed ideas and possibilities. Today, we are talking about what we are doing right now to fully leverage the opportunities that Medicaid eligibility brings to the jail-involved population. It's an important conversation. We have an exciting agenda for you today. We are privileged to welcome Tony West, Associate Attorney General of the United States, and Michael Botticelli, Deputy Acting Director of the Office of National Drug Control Policy, as our keynote speakers today. Our panel discussions will draw on issues raised in several health affairs articles and present concrete examples of what policymakers and practitioners are doing across the nation. Some of the authors of those articles are here today as panelists. We have a lot of time in the agenda for your participation in each of the panel discussions. We are relying on your experience, insight, and knowledge to deepen the conversation today. Our staff will be roving the aisles with handheld microphones during each of the panel discussions, so please flag them down to join the discussion. We encourage and appreciate if you did so. A few housekeeping items before we get started. First, the most frequently asked question is where are the bathrooms located? If you need to use the restroom, they're right down in the foyer to the right of the stairs. You walked past them on your way up. Second, a quick reminder to please silence your cell phones while the meeting is in session. That'd be very kind of you. Limit distractions. Also, please be sure to pick up a copy of the conference packet downstairs at the registration table. It includes a copy of the special edition of Health Affairs and a revised 2014 edition of Cochs' Glossary of Criminal Justice, Healthcare, and Information Technology terms relevant to the work we are focused on here today. Most of you are already aware that this meeting is being webcast live so that we can reach as many people with the information and ideas we are discussing today. Lunch will be held on the second floor of the Thunder Grill, right here in Union Station. You will need your meeting badge to be admitted, so please be sure to wear your badges. Cochs staff will guide you to the restaurant, but we have confidence you'll be able to find it. It's right out the doors and to the left. But if you can't, we'll help you, gladly. You'll find a meeting evaluation form in your folder. Please take a moment later this afternoon to complete it so we can be sure we are meeting your interests and needs with our work. Your feedback is appreciated. Recognizing that you're all busy people with places to go, planes and trains to catch at the end of each day, we'll do our best to be extraordinarily punctual. And once again, on behalf of coaches, thank you so much for being here and taking a part in this conversation. And now it's my pleasure to welcome Jane Hebert-White of Health Affairs, who would like to say a few words.